saying that alcohol doesn't discriminate. I can tell you a beautiful thing about alcoholics. They get discriminated like hell. Sorry for swearing in, but I've seen in ERs, people walk in when the smell of alcohol, that's the end of the story. They don't get the medical care that they need. Everything is put on drink and then they are just put it out. I've seen numerous things happen to them. Numerous things, heart attacks, brain problems. They get ill-treated. So there's a lot of discrimination going on with alcoholics, if I may say so. Well, we talked about people who are famous, people who have problems, who had problems. Some of them have died in this place, some of them are still living. We see them, this person, Dharmender, I've seen him numerous times getting drunk and then, on the TV, you see him, this beautiful woman died. All these people, this guy is not even 26. He got addicted to alcohol shooting his third film. He was like what, 10 years old? That's how powerful alcohol can be. And these were all people who were performing. Mickey Mantle. This guy threw everything away. So, why is it considered a drug? Because it changes our physical and emotional state, and it is classified as being a depressant. And the reason why we classify that as a depressant is because it causes a lot of slowing down of the system in general. The brain gets slowed down, and the moment the brain gets slowed down, your body gets slowed down. And that is after you had a couple of drinks. What's a drink? It's 12 ounces of beer, that's equal to almost 5 ounces of table wine or 1.5 shots of whiskey, spirit, rum, gin, whatever you want to call that. Social and moderate drinker, we say the social and moderate drinkers are somebody who drinks 2 drinks per day. Could be drinking for 5 days, 6 days, 7 days of the week, but it could be 2 drinks per day. For women, it's 1 drink. Sorry, women, I'm not being sexist. It's just the way that is. And for older adults, it's 1 drink per day. That's because they are more lean. Their bodies have less water in them. That's why. Intoxication. What is it? It's what we see. It's what we see. What do we see in intoxicated people? They just talk, right? They yell, scream, they just sway. All this is intoxication. There's no correct definition for it. And so I just wanted to say a few terms here. One is alcohol use disorder. We see that a lot in medical literature. It's nothing but the doctor saying you've got alcohol problem. That's all. And what does it do? It causes, how do doctors say it's an alcohol problem? When we say the problem is causing the person distress to themselves or to the family or to others, in general. And then binge drinking is when we have 5 or more drinks, 1 occasion in a month. Heavy drinking, 5 or more drinks again, 4 or 5 times in a month. So you can see this is binge drinking, that proceeds to heavy drinking, and then that can proceed to alcohol use disorder. Can, cannot, may not, but that's the sequence. And then there's underage drinking. Anybody who's under 21 who drinks is underage drinking, period. That's the law. There's no 18, I'm 19, nothing like that. And when we have blood alcohol, this is BAC, is nothing but blood alcohol concentration. When we check the blood for the alcohol percentage, it says 8 points of alcohol and 100 points of the blood. When you reach this limit, that's your driving under influence. And that's the federal law. So what's the harm? Many people who drink, 7 out of 10, this is the recent census, 2014, 7 out of 10, they drink within limits. They don't have a problem. There's only these 3 people out of the 10 people that we're talking about that have the problem. What can it cause? It can cause a lot of things. Drinking has been implicated in too many things. Like 65% of the total injuries, drownings, homicides, alcohol has been involved. 50% of the like 1 in 2 of every traumatic injury, alcohol is involved. Almost like 1 in 2 of all the motor vehicle accidents, alcohol is involved. Health problems. It can cause a lot of health problems. It can cause liver disease. People have spoken about heart disease, sleep problems, depression, anxiety, stroke. It can cause hemorrhagic stroke, pretty bad ones. It can cause bleeding from the stomach. It can cause sexually transmitted infections, cause, when we're on alcohol, we don't lose our inhibitions. So it can have unsafe sex. Several types of cancer have been, implicated in that. People have managing problems, with diabetes, high blood pressure, other conditions because of alcohol. It's just a poster that was there in, this girl, she was a victim of the drinking fatality. Kids under 21 or over 21, the alcohol percentage, blood alcohol percentage is the same thing. 21 or older is 0.08. Under 21, don't drink and drive. Men and women, I'm talking about the differences. Women are more lean, they have much of body fat, they have less water in them. So that's why they're going to get drunk quicker than compared to men. Almost like 50% more. Little more stats. Somebody told me, never talk in the presentation about stats, but without stats, how am I going to scare you? I got to scare you. I got to make you feel that it's a problem. And I'm talking about a disease burden here. So, I need to go through some stats. Nearly 88,000 people die every year. This is like 2014. They died of alcohol-related causes, and it's the 4th leading cause. And what are the 3 other leading causes? Avoidable. These are all avoidable. Smoking, high blood pressure, obesity. So basically what we are saying to you is don't eat, don't drink alcohol, and don't smoke. Do the rest of the things if you want to live. And look at the money that it costs the Federal Reserve, 249 billion. That's like 1/3 of the actual cost of the war on terrorism right now. 1,300 billion was the cost of the war on terrorism since the last 20 years. And 1/3 of it is just alcohol. That's how much we pay back. This value didn't come up, it's like 25%. So binge drinking in 2014, of all the adults in USA, at least a quarter drank binge drinking, at least a quarter. And this is like 7% here. The value didn't come up, but it's 7%. So 7% of adults right now in the US, they are having some sort of alcohol use disorder. That's a lot. Adolescents, 3% of all our adolescents below the age of 17, they are addicted to alcohol right now. That's a staggering number, considering these are all children, right? And this is 40%, like as I told you before. Driving fatalities, 40% of the driving fatalities, they are linked to alcohol.
So you said 3% adolescents, right?
Yeah, 3% adolescents are actually addicted to alcohol.
That's 9 million. 300 million population.
Yeah. And it's comparable to any other disease, like asthma, diabetes, and what it needs is lifestyle modification. It's exactly comparable to diabetes. It's progressive, gets worse, and it relapses. Genetic factors are important. I've had people come and told me that my father is an alcoholic, so I'm going to turn an alcoholic. Yeah, that's true in certain cases, but not all the time. It's important. It's very important, but it's not the only cause. The cause for alcoholism is multiple ways. And the more advanced problems we have, the more symptoms we get. And the treatment requires lifestyle changes. So does it change the brain? Is the question, right? So generally what happens is when we have our natural pleasures, like we eat food, we think about a romantic song, we go with our lover, we go with our wife, and we get some rush in our brain, right? These are all the pleasurable hormones, the happy hormones that get released whenever we have a pleasurable event, like sex, like food, like some other thing. The same thing happens with drugs of abuse. The same thing happens. These chemical triggers happen with drugs of abuse as well. And alcohol is one of the drugs of abuse, right? And what are addictions? Addictions are the persistent and they're destructive and uncontrollable behaviors, right? And it could be anything. Addiction could be gambling, could be sex, could be alcohol, could be heroin. So addiction, is defined as continued pursuit of a substance or activity in spite of the negative consequences. That's the textbook definition of addiction. And moving on. So is there a pattern? No. People use, they don't become addicts. People could abuse, they could binge drink, they will not become addicts. There's only certain people in the population that become addicts. Like remember, 7 out of 10 people, they drink but they don't become addicts. So there's something in the chemistry. There we go. It's a complicated picture, but I didn't want to include the biological structure of the brain, so we tried to do it with schematically. So what we're talking about is, this is the place, this is a few places where pleasure is located in our brain, right? There are pleasure remembering centers, there is a pleasure center, there are pleasure interpreting centers in our brain. And this is all the intelligent part of the brain. The top part is all the intelligent part. This is where we make the choices. This is where we make all the intelligent decisions that we make. And these underlying structures, these are much more within the brain, inside the brain. This is where the pleasure is located, because we as animals, there are only two things that we are programmed to do. One is seek pleasure, two, to avoid pain. We do anything, all the activities you can compare. There's only two things we do. We either avoid the pain or we seek pleasure, right? So these places in the brain, we're talking about this place, there is this emotional processing happening, and then there is emotional memory there. Memories get stored in this place, but this place in the brain, it actually modulates the memory. It actually, let's say for example, let's say for example I drink, and then I associate dancing with drinking. The emotion, what we're talking about, the emotional memory modulation and emotional memory is, at some point in my experience of dancing and drinking, I associate drinking with dancing. Then it becomes like drinking with pleasure, because I used to get pleasure from dancing, now I get the pleasure from drinking only. So dancing, the middle bit is gone. And that's what we talk about memory modulation. We talk about that small change in the memory, the way the memory gets stored, that happens in this place, inside the brain. And there are pleasure hormones running all over the brain. And what does this place do? This place, it actually interprets. Like I told you before, we're talking about the intelligence here. We're all intelligent people, we associate things, we remember things, we learn things. And all these things are getting controlled by the underneath structures which we don't have control over. It all gets processed inside. So when we talk about the choice of not being able to stop after the first drink, this is what we're talking about. Having to decide the first drink is here, the intelligence. But having to decide, not being able to decide what happens after the first drink is where all goes wrong. Well, what are the things? This is us, this is alcohol, this is the environment around us. These are the three things that are involved in anybody's drinking or nobody's drinking. So what are the outcomes? When we see alcohol, I might not drink, I don't want to drink today because today is my wife's karwa chauth. I don't want to drink. Or I may drink a couple of drinks and I have to drive, so I drive. So that's where the environment plays a role, right? Or I may start abusing the drink. I may get addicted to the drink. So what are the things, what are the factors we look at? The availability. When I used to live in Britain before, and when I first went in 2002, the Tory government, the Labour government then was like, alcohol was only available until 10 p.m. in the supermarkets. After 10 p.m., no selling of the drink, period. And 2003, Britain, the Tony Blair changed the law saying it's 24 hours selling of alcohol because availability increased. So does drinking increase, because people can just drive to the supermarket at 12 in the night and get the drink, right? And then that's how drinking could start. And the strength of alcohol. We talked about beer. Beer, my dad says beer is not drink. I'm like, Dad, beer is drink. Beer is alcohol. He says, no, beer is not alcohol. It's only 4%. But, so the strength matters. Some people just drink a couple of beers and then they might, I've had stories, the people used to say, if you drink whiskey slowly. You drink like beer, you drink whiskey like beer, you're going to get drunk quickly. And the price matters. I have a lot of patients who drink $5 vodka bottle. Because after they get drunk, that is the only thing that they could afford. And the taste, wine drinkers. They blame it on the taste, right? And the glamour associated with it. And again, we talk about the host, that is us. The individual vulnerabilities, the genetics of it, the metabolism. Dr. Makija was talking about the metabolism. What we know of now is that the people who cannot metabolize alcohol at all are getting drunk even with 1 or 2 shots are the Chinese, Oriental people. They have a completely different kind of genetics in them. One of the things that chemicals that burns alcohol down in the bodies, it's like a different kind of a chemical with them. So they burn alcohol pretty slowly, so they get drunk pretty quickly. And the people that can metabolize alcohol really quickly, really properly are the Scandinavians. They are the topmost people. They just drink like anything. They can drink. Caucasians fall in the middle somewhere, and then comes the African American population. They fall in the middle somewhere, and then we fall after Chinese. So we get drunk pretty quickly. When I say we, I'm talking about the South Asian population. Color, remember? And the environment. We talk about the environment, that's where all the other cues come in. Boredom. Boredom is one of the things. Role models, my seniors, my professor offers me a drink and he's successful, he drinks. So maybe I'll catch one drink with him. Maybe. Peer pressure. That happens to all of us, right? We go into a meeting and everybody else is drinking and somebody offers you a drink and says, you don't drink. Dr. Makija was talking about this. You don't drink, you're from USA. And the culture too matters. So this is the addiction side. It looks like a very complicated one. It's not actually complicated. Emotional triggers is what starts first. We could have a physical reason to drink. Spiritual root. It's like after a while, after you start drinking, you start associating alcohol with, your. Like I tell my patients, you drink, okay, fine. You stop the drink. You got all the time in the time that you used to spend with the drink. The drink is a companion, right? And then you spend a lot of time with the drink, seeking the drink, enjoying the drink, living off the drink. The drink is gone. The partner is gone. The spiritual partner is gone. What would you do with that time? That's where the spiritual thing comes in. And what happens? They drink that to ease the pain. Like as I said before, to ease the pain. Initially it starts at normally, and then when we talk about addiction cycle here, so once the person gets addicted to alcohol, to ease the pain is why they drink. And what happens? They drink and it eases the pain, they drink and it eases the pain, and it becomes a cycle, right? And the problem is still there, right? I still have the anxiety. I still have anxiety when I go into meetings. I still have anxiety when I see people. But what I used to do is I used to drink, so I masked the anxiety. Fine. So what happens? Every time I go into a meeting, I drink. Every time I go into a meeting, I drink. So I'm actually not addressing the problem. I'm just masking it. I'm just using the alcohol as a small support for me. And as these experiences become short-lived and short-lived, because I'm going to metabolize alcohol quicker and quicker as I go along, as my body gets used to it, right? So these experiences of me getting rid of the anxiety becomes shorter and shorter. So I have to drink more. And then that's when the craving starts developing, because I don't want this anxiety pain in me. This mental pain, I cannot take it. So that's where the craving starts. The compulsion to drink. That's where it starts, because now I have cravings for it. And what happens if I don't drink? I get snappy, I get angry, I yell, I scream, I get anxious. So to stop that, I have to drink. That's where the enjoyment with alcohol stops. And then it becomes this thing when you have to drink because you got to get rid of the pain. This is where the problem starts. The alcoholism is where this starts. So the natural pleasures that I used to get, like sex, like, earning money, like eating, good food, playing with children, All of that goes out of the window, and I'm only doing this ritual to get rid of the pain, the mental pain. And the relief, is this there? No, it's not there. It's very temporary. So the relief goes out of the window as well. And my life becomes much more dysfunctional now. And then guilt starts creeping in. The guilt starts creeping in because, I'm not able to perform in my job. I'm not able to, maintain relationships. Wife leaves. Don't spend time with your children. So the guilt starts coming in. And to relieve that mental pain, I drink more. And the addict can never get out of this cycle if he or she does not, get rid of or break the cycle. So craving in brain. The addict is someone who gets hooked. So he's not getting high anymore. He just got hooked to the substance. So he's like desiring, he's like intensely wanting more. He's lost the control. This is called craving. We talked about this. And it's actually, there's numerous studies done on it, numerous. I can't include all that here, but imaging studies have shown like multiple times, and people were given their substance of the craving, and then they were taken scans of the brain, and it showed that the pleasure centers we talked about, that they had much more activity when the people were actually getting their substance that they want. So imaging studies have been done to show it. Why does somebody relapse? Well, there's a lot of reasons why somebody would relapse. One of the things that people say is, let me have this one drink, or let me drink a beer. I used to drink whiskey before, that was stronger. Let me have a beer, beer is okay. So we try to do it in a different form, and that could lead to a relapse. And exposure to cues. When we talk about exposure to cues, we're talking about an addict driving in front of a bar, sees the bar, and then something clicks in the brain. Because we talked about the emotional memory, right? So the emotional memory kicks in and it says, ooh, that is associated. The bar is associated with some sort of pleasure. So I walk in, just for one drink, And then stress could lead to it. So that's why when we say to people who smoke or people who drink alcohol, people who smoke, for example, we say all the time, when you want to stop something, tell your friends. Don't be around them when they drink or when they smoke. Because the cues are important. This is just a simple test that we do to just say, have you got an alcohol problem or not? This is something that we can do generally anywhere, like bedside, like in a train station or anywhere. There's only 4 things in here. It's called CAGE questionnaire. It's internationally accepted one. If you get 2 questions of yes answers in the 4, then you need to go further into your alcohol drinking and then think about it. Think about, are you an addict? What are we talking about? Have you ever felt the need that you yourself, have you ever felt that you should cut down your drinking? People around you, have they annoyed you? Or have they got annoyed? Or have they criticized about your drinking? Ever? Did you ever feel guilty that you're drinking more or you're drinking too many times? Or have you ever drank alcohol as an eye-opener, as in, I don't feel good, let me have a drink and then I can start my day. If any of the 4, in any of the 4, if you have 2 yes responses, then it means that you need to drink, not drink, but then, address your drinking. These are some of the questions that I want you to remember, and then we can discuss in the Q&A. Is there a structural problem in the brain? Is there one? This is something that we can talk about later. And then the other thing we're talking about, how can you compare my drinking with diabetes? Diabetes is something that is involuntary. It happens to me. My sugar is out of control. There's nothing I can do. How can you compare that with me picking up a drink? Picking up a drink is voluntary, right? So think about this, and then we'll talk about the Q&A that we will do in the end of all the presentations. And thank you for listening.